According to the Kansas Department for Children and Families, or the DCF, in 2017 there were 7,192 children in foster care and only 2,755 licensed foster homes. Kansas should deprivatize their foster care system. For the last 4 years, I've worked with children, and I've seen firsthand some of the numerous things that have happened in foster care to our children, including cigarette burns on skin, bruises, and children showing up to school with moldy food in their lunch boxes. And this is just some of the problems that our children are facing when they come to school and they're in foster care. Doing away with a privatized system would help make the children in the system the #1 priority. First, I want to illuminate some of the issues in Kansas's current foster care system. Second, I want to imagine what a government-ran foster care system could achieve. And third, I want to encourage Kansas representatives to propose a Kansas foster care reform bill. To begin, Kansas's current foster care system has many flaws. The foster care system in Kansas is privatized. Kansas is one of only 7 states to have a fully privatized foster care system. The decision to privatize happened in 1997 when the DCF was found unable to correctly care for the children in Kansas within the system. Privatization means that private firms handle services regarding a product, and in this case, the product is children. In Kansas, the contracts in charge of managing the children and their placement are the KBC Behavioral Health Care and St. Francis Community Services. The issue with this system is that these contracts are making money off of our children. According to Dr. Jamie Schwant, author and former Kansas foster child, the contract with the DCF states that St. Francis and KBC are paid only when a child enters and remains in foster care. If the children are adopted or reunited with their families, the agencies do not get paid. The privatized system creates communication discrepancies within the people involved with the children as well. The KBC and St. Francis are not transparent with their subcontracts on available homes. They do not get paid if a child is placed in a home by a different agency, so they simply don't talk about children needing to be placed in homes closer to their families. The next issue is that DCF is not collecting important data. In 2017, the Legislative Division of Post Audit stated that there were errors in DCF's data on children's removal addresses, placement addresses, beds in licensed foster homes, as well as children's physical and mental health. Collecting data helps create PIPs, which are personalized improvement plans, which have measurable data that can actually be achieved and goals that are made for the children to help keep them safe. The DCF also has an outdated auditing system, which makes collecting the data for those PIPs nearly impossible. The next issue is with the caseworkers in the system. Caseworkers have been reported as having more than twice as many cases as recommended by the Child Welfare League of America. Caseworkers are also underpaid. The degrees required to be a caseworker are the same degrees needed to become a counselor at a school, which pays way more. The last issue is that children are still going missing and dying within the foster care system. First, I highlighted some of the issues that Kansas faces with their foster care system. Next, I want to explain how deprivatization might help the system. Deprivatization would fix many of the flaws with the current foster care system in Kansas. First, it would provide the system with transparent communication about removal and placement home availability. The system will no longer be competing to fill certain beds in certain areas, so children can be placed closer to their families, which is one of the major goals that the DCF has. Children will also exit the system faster without the incentives to keep them in foster care. Second, it would create an incentive for more caseworkers, because government-ran systems pay their employees and caseworkers way more. A deprivatized system would allow more room for a group of people to oversee hiring qualified caseworkers. Third, it would force the DCF to upgrade their auditing system. The data would help create those PIPs that we so badly need to protect the children in the system. The data itself will also create transparent communication about foster care youth in the system. Last, deprivatization with all of these things would help make the children in the system a priority. I've told you what deprivatization would do for the system. Now I want to encourage Kansas representatives to propose a Kansas foster care reform bill. A reformation of the current foster care system is so badly needed. A reform bill was proposed in 2017, but lacked information on how reformation could happen. The issue of funding has been raised in regarding the reformation of the system. According to Jonathan Shorman of the Wichita Eagle, reformation may cost Kansas up to $40 million in federal funding. Kansas gave nearly $155 million in funding to St. Francis and KBC in 2017 alone, which was used to put kids in foster care and keep them there. Increased taxes would be inevitable for this bill because of the lack of funding. Taxes have been raised for many other public issues, including libraries and water parks. Kansas representatives need to be aware of all the facts and concerns they're facing when they propose a reformation bill. To recap, Kansas should deprivatize their foster care system. The current system has many flaws which aid in failing the children in the system. Deprivatization would address most of these flaws. Kansas representatives need to highlight the good a reformation bill can bring, while empathizing with the hardships it would bring to the state. Now that you know the issues our current foster care system is facing, I encourage you to reach out to local and state representatives to get a bill passed that will make the children in the system a priority. I also encourage you to educate yourself further on how you can aid in helping the children in foster care. If you're worried about the money it would cost you to help, please remember that it's a public service duty to care for our children in the state. Our children are our future. We cannot be afraid to invest in them. Thank you.